do it. I'll just do it.
You sure? It's up to you. Okay.
So I turned it off.
Wait.
All right, we ready?
I think we're ready.
All right, good afternoon and welcome. So happy that you are in here to hear this wonderful presentation. I'm Katie Morell, and I am with Morellis Pharmaceuticals, and I'm in marketing development. And I have the distinct pleasure of introducing Miss Amanda Mitchell, who is the Executive Director of the Epilepsy Alliance of Louisiana and the Program Chair for the Epilepsy Alliance of America. And so without further ado, I'd like to introduce Miss Amanda Mitchell.
Thank you, Katie. Thank you, guys. So as she mentioned, I am the Executive Director for Epilepsy Alliance Louisiana, and I'm on the board for Epilepsy Alliance America. But the reason I do this job is for Jackson. Jackson is my 6-year-old son who does have difficult to control epilepsy. So this work means a great deal to me, and particularly this training. How many of you are parents or caregivers or people with epilepsy in the room? All right. And so how many of you have had seizure first aid and safety training before? Either on the job or a formal training. Okay, so it looks like mostly everyone. Usually I kind of start these with doing a little Q&A to get people more comfortable, but today I have a really important question for you guys. What is something you wish that people knew about seizure first aid and safety? Does anyone have something they wish that people knew that they don't seem to know? In the back, yes.
That they don't need to put anything in their mouth.
That they don't need to put anything in their mouth. Anybody else?
There's different types of seizures?
That there are different types of seizures. Those are both things. I've been doing this work for about 5 years, and we still do see that people don't always know the answers to those. And so that is a lot of what we do in this training, is to help people to feel comfortable and confident in responding to a seizure. Because it is scary to experience a seizure, and it is scary to witness a seizure. And so it is for the safety of our community that we do this training as well. So we will get started. Let's see. Oh wait, I made this work before. Nope, not that one. This one. All right, so I talked a little bit about our objectives. So we are going to talk about the 4 most common types of seizures, and then different treatments. This is the training that we do for our school teachers in Louisiana, so it has a little bit of that information in it as well, but that's really a minor part of the training. So again, what is epilepsy? No. Okay, that's okay. So when we talk about what is epilepsy, what we're really looking to try to get people to understand is that epilepsy is a spectrum of conditions, right? And that it impacts more people than anyone ever realizes. So we really like for people to remember that 1 in 10 people can have a seizure in their lifetime. And then 1 in 26 can go on to develop epilepsy. That means for most of us, we know someone who has epilepsy. We have more than 26 people in this room. I know we're at the epilepsy conference. But this works out again and again and again when we do these trainings. People will come up and they'll say, we don't really know anyone. And I can almost promise them that you do, but they have not told you. And that if you take this training and you start talking about it, I guarantee you people will come to you and talk to you about their epilepsy and what their life is like. So what are the common causes of epilepsy? For about 30% of people, it is a known cause, either a brain injury, a lesion, possibly poisonings, infections of the brain, or abnormal brain development. For the remaining 70%, we don't know and presume that it's genetic. One of the things as a parent that I have been most encouraged about over the past 5 or 6 years that I've worked here is to see how far we've come with genetics. So when my son was first diagnosed and he had the common epilepsy gene panel, at that time it had about 50 genes on it. Now it has over 300. That's in a 5-year span. And what I have seen working with families with epilepsy is as we continue to expand our knowledge about the genetics of epilepsy, treatments have improved. And while we still don't know the cause of my son's epilepsy, it has been really encouraging for me as a parent to see how that has played out for other families, to see how it has decreased the time for them to get the treatment options that they need, and the hope that if we continue on, that we can all have that one day. So what is epilepsy? Well, we know that a seizure is an event. And then epilepsy is when you have recurring and unprovoked seizures. And epilepsy will be diagnosed typically in two ways, is if you have two unprovoked seizures in more than a 24-hour period, or one seizure with something else that increases your likelihood. So again, for those of us who live it, we know that makes a very wide range of what it can mean to have epilepsy. But this is something the general public still really doesn't grasp well. Nope, not that one, this one. So again, with myths versus facts, this is a lot of the work that we try to do in the community, is to help people understand what are old wives' tales, and then what is fact. So most seizures are not medical emergencies, but those of us who have experienced them, such as myself, know that it is really, really important for us to be able to identify and respond to a seizure that is a medical emergency. People may not be aware that they are having a seizure, and they may not remember what happened. Epilepsy is not contagious, it is not a form of mental illness, and that a person cannot swallow their tongue. It is not physically possible for you to swallow your tongue. And so what is a seizure? Well, a seizure is a change in the normal electricity of your brain, and it results in changes in one or more of the following: movement, sensation, behavior, or awareness. And I find that awareness piece and the behavior piece are the ones that people really have no idea can be impacted when a person has a seizure. So there are two main types of seizures. There's generalized seizures. Those impact your entire brain at one time. And then there are focal seizures. And those only involve one part of your brain. And so again, while we only go over 4 of the most common in this training, there are over 20 different types of seizures. And people with epilepsy can have more than one type. And when I am doing this for teachers of the general public, what we like to impart on people is we don't expect you to name the seizure, right? That is not the whole goal of this training. It is to identify whether an event could be a seizure and then how to respond. And y'all, they keep changing these names. These have been updated several times, but at this point, we are on to focal onset impaired awareness seizures, or what used to be called complex partial seizures. So these are a focal type of seizure, and awareness is impaired, and they will often begin with a dazed stare. People can experience automatisms, they will be clumsy, and they typically last 1 to 3 minutes. Now, I've talked to people, if you were familiar with the person, you'll notice there's a change in gait, that they aren't quite walking right, that they are clumsy. One of the automatisms can be like picking at your shirt or opening and closing a door. We also do talk about these when we train our police officers, because they can be easily confused with being drunk or on drugs. So it is really important for our police officers to be able to understand that this is a type of seizure that can occur, and that the person is not in control of their behavior at this moment, right? Their brain is not talking to their body as it should. If a person is experiencing this type of seizure, we never want to restrain them. Oh, still not that one. I'm going to put this up here. The second type of focal seizure is focal onset aware seizures. So for these, full awareness is maintained, but the person may experience rhythmic movements of one part of their body. Sensory symptoms or psychic symptoms are also commonly occurred with this type of seizure as well. And they usually last less than 1 minute. This is one where people will commonly say that they have an aura. And so this, auras are seizures. These could be things that a person can experience. For several people, like my son, if he experiences this kind of seizure first, it's usually the start of larger seizures. So it is really important for people to be able to identify these early on and possibly be able to intervene or be prepared for what may come next. Generalized onset non-motor seizures are absent seizures. So this is when there is a pause in activity with a blank stare and brief lapses of awareness. You will get a possible chewing or blinking motion, and they last 1 to 30 seconds. These may occur multiple times a day and can be confused with daydreaming, lack of attention, ADHD, or behavioral issues. And a lot of times when I'm training teachers, this is when we get the question, Amanda, how do we know? Like, how do we know the difference? And as myself as a parent, it's been hard to know the difference sometimes. But as a reminder, right, we're not neurologists and we don't have EEG machines. So our goal here is to observe and report. What are you seeing? And then what is the impact for this person? Because with absent seizures, particularly in schools, we'll often see that a person is experiencing these for a really long time before someone can catch on. And I've even had parents who go to school and they're like, my kid is having absent seizures. And the teacher's like, no, they're just daydreaming. We're not daydreaming, right? It is not the same thing. And so it is really important for our educators and people who work with us to understand how to identify these and what is the difference between the two. Because there is a difference between daydreaming, right, and being unconscious and having a seizure. And then the last seizure type is generalized tonic-clonic seizures. So these are the ones that most people are familiar with. You will have a sudden hoarse cry, you will lose consciousness and fall down, you will experience convulsions, shallow breathing and drooling. Your brain is not talking to your body, so there's a possible loss of bowel or bladder. And then sometimes the nails, skin, and lips may turn blue. And these generally last 1 to 3 minutes, but as many of us know, they can last much longer. Y'all, these suck. There is no other way to describe it. You feel bad. Your head hurts. You're confused. You're tired. And you're sore. And I have found that the longer the seizures last, the longer it takes for a person to start feeling themselves again, right? And that is okay, to need that time and to need that rest. And that is part of, in school or in work or in life, for all of these seizure types, that it's really, really important to do is give yourself the space that you need to get back to normal, to get back to your baseline, and have that really supportive group around you to help you do so. All right, so again, we talked about focal seizures, which are complex partial and simple partial, and then generalized seizures, which are absent seizures and generalized tonic-clonic seizures. So how can epilepsy impact a student's learning? Well, seizures can cause short-term memory problems, which can mean that afterwards, coursework may need to be taught. It's important for people to know that even if you are not seeing, right, seizure activity, if you are not witnessing the seizure or the person is not aware that they've experienced a seizure, it can still impact learning. And while again, this one is geared towards students, this tracks for adults as well, right? This could be something that they may need to talk to their boss about or whatever other activity that they're doing so that people are aware if you understood something one day but not the next, that could be a result of epilepsy. But in addition to seizures, right, medications can cause some of these same things. So drowsiness, inattention, concentration difficulties, and behavior changes. I do always recommend that if you are going to change a medication, that you consider alerting the people around you, whether that be your teachers or someone you trust who's going to be near you. Because I have personally seen what can happen, right, with behavior changes when medications change. And it can be really helpful to you to have somebody else who's already waiting to help you and support you if you have that change. So while epilepsy itself is not a mental illness, it can commonly co-occur with mental illnesses, especially anxiety and depression. And one of my big advocate points is that people with epilepsy are 5 times more likely to die by suicide. That's a big deal. That is a big number. And a lot of that comes from the isolation and stigma that is still experienced today. And so that is another reason why we are here today, to stand up and to be seen and to say we're here and we are living with epilepsy, or we care for someone with epilepsy, and we're not going to let it stand in our way. So what are some seizure triggers? So this can be really hard sometimes for people to understand, right? Because epilepsy is unprovoked seizures, and yet here we talk about things that can trigger a seizure. So what this means is that it just makes a seizure more likely to happen. The number one reason for a breakthrough seizure is missed or late medication. And y'all, this can be really, really hard, right? So in our house, we have this thing where I annoy my husband. Hey, did you give him his medicine? Yes, you watched me. Answer my question, thank you. Did you give it to him? And that's my backup plan. So he gives the medicine, and then our backup plan is I always verify that he has given him the medicine. If we leave the house, then I set an alarm for his medication times, both morning and night, right? Because it can be super easy when you are traveling, when something changes in your schedule, to, oh, I was supposed to give that like 3 hours ago. So always having that alarm, if we know that our schedule is going to be different, is very helpful for us. Flashing lights is another one. And so people can sometimes be familiar with that and think, oh, we just have to like not run up to the light switch and flick it on and off and on and off. But they can be unaware that things like movies and Instagram and Snapchat, can you do video on Snapchat? Actually, I'm not sure about that one. But the Avenger movies are one of the examples that we use to describe this, right? So everything flashes across really, really fast, seen over scene, and there are no trigger warnings for any of these things until it starts to happen. So we do always recommend that if anyone is going to show a video, that they watch it fully if they know the person is sensitive to flashing lights. Stress or anxiety is one, hyperventilation, lack of sleep, and fatigue. So it is really, really important for all of us to get good sleep, but particularly important for people with epilepsy. And y'all, I had this wonderful parent say something a couple of weeks ago that I had never heard anyone say before. Not only did she tell me she was really mindful of when her daughter went to sleep, but she was also really mindful of how she woke her up. So they don't set really loud alarms. She doesn't go in and like throw off the covers and those kinds of things. She's like, I actually started waking her up about 30 minutes before, so we could do it really calmly and gently. And I'm like, that is brilliant. The first time in 5 years anyone has ever mentioned that to me. So that's another good strategy to consider if you are sensitive to sleep. Hormonal changes, illness, drug and alcohol use, drug interactions from prescribed or over-the-counter medications. This is one we do not give an over-the-counter medication without talking to the pharmacist. So if you have any questions whatsoever, you can take the medication to the pharmacist and double check. Energy drinks, overheating, poor diet or missed meals, and then vaping as well. I don't know about any of the other parents in here, but every time I see these, I have to take a deep breath and remind myself that I can't keep my kid in a bubble. Did anyone else try to keep their kid in a bubble or their significant other in a bubble, or not let them go places, or, actually keep a whole list, right? This is what time they woke up. This is the exact time that I gave them their medication. That doesn't work for life, right? That is not fun for anyone. So what we have grown into, though, is what are our rules, right? On a regular school night, we're going to bed at the normal time. We'll do everything possible. But are we going to skip the holiday party or the super fun thing because he's going to be up an hour later? No, we're not going to do that. Or are we not going to go play outside because it's going to get hot and I'm nervous about that? No, we're not going to do that. We're going to bring water, we're going to bring our cooling towels, we're going to monitor what everything looks like. Because I did try to keep my kid in a bubble, and he had seizures anyway, and everyone was miserable. And so while it's really hard for us as parents and caregivers, or sometimes as people with epilepsy, I've talked to people with epilepsy who are scared to go out, but we have to figure out how. And we have a community that can help us. So find a support group, call one of us from your local EAA chapters, and we can help you figure out how to live your life, because that is the goal. And so it is important to remember that epilepsy is a spectrum disorder and is specific to each individual person. So for my son, in addition to ensuring that his teachers have this training, I also do share the actual videos of what his seizures look like, because he has several that aren't covered here. Or I've had people who do have complex partial seizures, who when they describe it, sounds completely different, right, than what we've described here today. And so helping people understand what your epilepsy looks like can be really, really helpful for them to help you. And so what are some treatment options? For 70% of patients with epilepsy, medication can control their seizures. We will be updating this slide very soon because the CDC actually just released data that says that number is only 44% of people. That means everyone else is at least having one seizure a year. For the people, where was I? Because I always get frustrated about that number. So for many of these people, the drugs available can help to control their seizures. There are over 20 different types of epilepsy drugs, and we also know those are all individual for people as well. And then, I thought we talked about it. Oh no, I think we took it out of here, but the other thing that we all know, right, is that the side effects of these drugs can sometimes be just as bad or as worse as the seizures. So what's really important is to know with the number of medications that we have, right, that is a conversation to have with your neurologist. Not only do they need to know is it controlling your seizures, but are you able to live well taking the seizure medication? And if the answer to that question is no, then that's something you need to bring to your doctor to discuss with them for other options. If medication does not work, which for some people it does not, then we are looking for surgery. And there are different types of surgery, and I do believe there's a whole section today or tomorrow about surgery. There are lots of different types of surgery. There is anything from neuromodulation, which includes the VNS, which is an implanted device, or an RNS, to different types of resections or ablations and things that they can locate. In that instance, it would be the seizure focus or foci. What is really important to consider when making these decisions, because this is another journey that I have walked personally, is what will be the impact on the person. What will be the impact on learning? What is the impact for them undergoing this testing? And what are the changes that you may see pre and post surgery? We are very lucky again that surgery is not what it used to be, and that there are a lot of places that can answer your questions. And again, if you are having trouble finding the answers to any of those, that is where we at Epilepsy Alliance America and our member organizations are able to help you. If you need to find the closest center to you, that would be better able to assist you if you are considering surgery. So as we mentioned, the vagus nerve stimulator is one of the implanted devices. So this one is implanted just under the chest and attached to the vagus nerve in the neck, and it sends a signal that kind of reminds the brain not to have a seizure. And what people can do with this one is they also do have a magnet that they can carry on them or with their caregiver, and if the person experiences a seizure, that magnet can be swiped across the VNS to give a additional pulse. People get really, really nervous with this one. All the teachers that I've ever trained, super, super nervous, right? You can't shock the child. It's not gonna like overdo it. So that's something, if you are explaining to people, we do actually have videos which are on our website that actually go through the steps to help people to, again, feel comfortable and confident in responding to a seizure. The ketogenic diet is another one that can be really helpful for people. It's the same diet that you kind of might see out in public on places as that high fat, low carb. When we're talking to people, we always remind them or teachers that if a child or a person is on this diet, that they need to stick to the ratio that has been prescribed. So then the teacher would need to be really mindful of if another student gets in the cupcake, if they have snacks in class, like what is that going to look like for the child or the person, so that you can help them still to be fully included in the activity. All right, so seizure action plans. So we do recommend that actually everyone has a seizure action plan, not just students. For students, these can go to their teachers to help them identify what a seizure looks like, but these can be really helpful for people at home if you have a babysitter or another caregiver. We have a mother who talked about going over her seizure action plan with her children, because if she's alone with them, then they're the ones who may have to respond in some way, so to help them to be comfortable. If you are at work and you need somebody to assist you, this is another place that it can be really useful to have a seizure action plan. So the way our seizure action plan works is it helps people to see what your seizure looks like, know if you have any rescue medications, and then know when a seizure is an emergency for you. And so having all of these very individualized information can be really, really helpful in a variety of situations. So our seizure first aid is we use the TRUST acronym. So T is turn the person on their side, R is to remove the glasses, U is to put something under their head, S is to stay calm, and then T is to time the seizure. So as we all know, it can be scary for other people to see someone having a seizure, and they might freeze and do all of these things that they really don't need to do. So helping people to understand very clear steps of how to help is really, really helpful. So again, we want to turn them on their side. And we want to do that because there is the chance of drooling or vomiting when you have a seizure. And if you're on your side, then it will help you to make sure that doesn't go back into your body. Removing objects, or especially glasses, anything around the neck will help to make sure the person can breathe. If they have buttons on their shirt, you can even unbutton the first two buttons, right, to make sure everything is not restrictive. To put something soft under their head. So this can be your hands, if you have nothing else, a pillow, a jacket, you can even put their head in your lap. And again, for schools and other situations, we do recommend having these objects available in the classroom or nearby, so that you're not running and trying to figure out what's going on. So my son does go to school with a pillow that gets put in his cubby in case he has a seizure. And then stay calm and stay with the person. This is, again, we never want to put anything in anyone's mouth. Their jaws can lock up, and so it can damage the inside of their mouth. It can also damage your finger. So this is a safety rule for both the person and the person responding. You never want to hold them down. Y'all, did anybody watch The Flash? Okay, well, I'm like 5 years behind, but I completely lost my mind about 2 weeks ago because they had somebody having a seizure, and all the doctors are like, come hold them down, and I'm like screaming at the TV, and my husband's like, that's not gonna do anything. And I'm like, but it is, 2023, we should not be putting hold people down in the media. That should not be a thing that happens anymore. So again, while we know all of these things, I train people monthly who do not. Oh, we're not supposed to put anything in their mouth? Nope. Really? Yes. Really, really, really. And then to stay with the person and until they're fully awake. The only kind of caveat to this would be as if you do need to go call 911, right? If that seizure has lasted a long time, if there's some other damage and you don't have your phone or a way to access that, you can go ahead and call and then come right back. And then the last one is time the seizure. So y'all, none of these steps are hard, but they are hard to remember in the moment, right? My son's first 5 seizures did not get timed. That was not a thing I was capable of doing at that time. But as I started to remind myself of all of the steps, it got easier and easier. The other thing you can do is if you need assistance, right? If you're having to protect their heads with your hand, it's going to be really hard to time the seizure. Or if you need to call 911, it's going to be really hard to do that. So in those instances, definitely ask other people for help. But also remember, they're not in their best place right now. So you wouldn't want to say, someone go call 911, because you know how many people are going to go call 911? 0 people. 0 people will move. So you want to look at them and you say, you can call 911 and you time the seizure and you will get people 100% more likely to respond than the other way around. Okay, so we went over that again. So other ways to help. So a lot of people do wear seizure ID bracelets. So if you guys haven't been to our EAA booth, we have these really cool bracelets there called the My ID bracelet. They have a QR code on the back. They're super easy to set up. And this is a lot for EMS and terrified parents of sending their kids to school. So my kid has one on his backpack, and it lists all of his medications, anything he's allergic to, what his seizure types are, and it's really, really easy to update. So if you are having to change medications and things like that, you can go right in and update them. They're super cool too. They don't look as clunky and as like medical as the old ones. And so definitely go and check it out, what those look like, because they are really cool. So the other thing is to make sure to protect the person from hazards. So ideally you want to move the hazard away from the person, right? So if they're near a chair or a table and you can push it out of the way, go ahead and do that. If, for instance, the person is near a body of water or the edge of the sidewalk, something like that, you can move them. Just be sure to do it as gently as possible, right, to make sure that they're safe. Remain with the person until they are aware of their surroundings. So again, people aren't going to know where they are. They aren't going to know who they are and who you are. So it's really, really important that someone stay with them to make sure they're safe. One of the things that we have found has been really helpful for people is to talk with them as they're coming out of the seizure, right? If you know their name, you can say their name. You can say, I'm Amanda, I'm here to help you. I'm gonna help you through this. You're at school, you're at home, you're in the park. Just anything that is calm and can help them reorient back to where they are. So when is a seizure a medical emergency? If it is the first time that the person has had a seizure or you don't know, we do consider that a medical emergency. Convulsive seizures lasting longer than 5 minutes. So these are like the tonic-clonic seizures that involve the full body convulsions. Anything lasting longer than 5 minutes does increase the risk of brain damage and death. And so we want to make sure that assistance get there as soon as possible. The average time for EMS to arrive in the United States is like 14 minutes. So calling as soon as you can help get them help as soon as possible. Repeated seizures without regaining consciousness. This was again one for me that was really, really hard to distinguish in the beginning of what this really looked like versus are they conscious, are they not conscious? But again, you're looking for somebody who is acting like can answer questions if they're able to do that, and not just yes or no questions like what is your name, what is your birthday. Those are things that'll help give you a better idea of if they are back to a more conscious state. More seizures than usual are a change in type. So if the person, you know them and you know what seizures they typically have, and they have a different type of seizure, then that would be considered an emergency. If the person is injured, has diabetes, or is pregnant, you always do want to consider those medical emergencies. And we all know, even if a seizure lasts less than 5 minutes, there is the risk of the person getting hurt. So while you don't want to put anything in anyone's mouth, there is the possibility of them doing significant damage to their tongue. And you may need to go and have that checked out. Or they may have a big cut or break a bone or things like that. And so that would be the reason to call. If seizures occur in water. So this one again was a super hard one for me. I'm like, wait, I'm gonna let him go in water? We're gonna let him swim? Like that's a thing that we're gonna do? That's a thing that we do, right? We do let him swim. Our recommendation though for everyone is that they have one-on-one. So that means one person who is near them who can remove them from the water if they have a seizure. And so then I follow him around like Mama Duck the whole time. But it is still important that that happens to call 911 so that they can get checked to make sure that they didn't take water in. And then again, if normal breathing does not resume. So if they still look blue, if anything looks weird with how they are breathing, you want to go ahead and call 911. So that is seizure first aid for our generalized tonic-clonic. For focal onset seizures, you do want to still stay calm and track the time. You never want to restrain them. Their brain is not talking to their body as it should. So you can cause damage to them or you can cause damage to yourself in attempting to do that. Instead, do your best to direct them away from hazards. So that would look like you could take them by their shoulders and you can move them. You could kind of stand in front of them. So if I was up here, right, we want to be very mindful to get me off of this stage because this is at height and this is dangerous for a person. We never want to expect them to respond to any sort of verbal instructions, right? They are unconscious during this time. And then again, follow whatever is their routine for their emergency protocol. If it lasts for more than 5 minutes or a different seizure begins. So for seizures in a wheelchair, this is when we recommend not removing the person because it can be really hard to safely remove a person from a wheelchair. If it is necessary, then you can do so as carefully as possible. But if they seem to be breathing okay, then you want to keep them in their wheelchair. You want to secure it. So wheelchairs have locks. So you can lock the chair. You can fasten their seatbelt so they don't fall out. And you still do want to protect their head. So this is going to look a little different because they're going to be sitting up. But what you'll do is you can stand behind them and again, ball up a jacket or even put your hands or stand so that they're kind of hitting your stomach. So again, it's just kind of giving their head some cushion and some protection during the seizure. You do want to try to make sure their breathing remains unobstructed and so that their head stays in a pretty neutral position for them to be able to breathe well. If you are a person who uses a wheelchair and has seizures, there are pads that you can get to add to your wheelchair to help prevent injury. Seizure on a school bus or a van or in a car. This is another super terrifying moment for families like when we travel. You do want to pull over where it's safe and then be very mindful of where you place the person. So if you were to be on a bus you'd want to place them on the seat with their head facing to you, or in a car, right? You want their head facing you on the seat, not on the floors where they could get trapped, or it could be really hard for someone to access them. If this is a school or a work event, then the driver should follow the necessary precautions. If this is your family, those are things you get to choose, right? Are we continuing on to our destination, or are we going back home? Again, seizures in the water are always a medical emergency, and to call 911. All right, rescue medicines. Who was just handed some rescue medicines? Here you go. Who knew how to use them? I was going to say, if anybody raises their hand, because I did not, and that was terrifying. But as my son continued to have status or prolonged seizures, I was very, very grateful to have them available. I just always wished that there was a resource to make it a little easier to learn how to use. And so that is one of the things that we actually developed, which I can show you guys at the end. But what are rescue medicines? So these are not everyday medicines. These are ones that are given for a very specific reason. And they are used to treat cluster seizures, or seizures that are specific to the person's, or different than the person's usual seizure pattern. This is something that if you have a student, or if you are at work, or if you are in another situation where your typical caregiver won't be with you, you can check your state's regulations on use by non-medical professionals. So in Louisiana, it is allowed for non-medical professionals to administer rescue medications. And that is because in our state, we do not have enough school nurses, so they don't always have a school nurse present who can administer the medication. So it is very, very important, though, if you have these medications, to use them. And now we have several different types to use, and that makes life a lot better when you have a choice of which one that works best for you. So the first one is diazepam rectal gel, or Diastat. Since you guys are mostly patient or people with epilepsy and then caregivers, I do want to point out this green ready band. So if you still use this medication, every single time that you get it, you want to open it up and double check that you see that green ready band. I have seen where a pharmacist has forgotten to pull that band, and that locks the medication into place to make sure you get the proper dose. So that is something we always do recommend double checking if you get that drug. This medication is administered rectally, but again, we do have videos and other resources if you need them to learn how to administer it. The next two are Valtoco, and Valtoco can be used in children ages 6 and older. And so this is one that can be used through the nose. Midazolam or Nazolam is another nasal option as well. And again, these are all really, really important medications. So if you are someone who experiences seizures that last longer than 5 minutes, or cluster seizures, and you do not have one of these medications, that is something to talk with your doctor about as soon as you can. And lastly, again, we are Epilepsy Alliance America. You can find resources, all the resources that I discussed on our website, which is epilepsyallianceamerica.org. So there you can get things like seizure first aid and safety posters that you can print out and put in places in your community that you frequent that will help people to be able to identify what to have with a seizure. We do have these materials available in English and in Spanish. We have our rescue medication videos, which are also available in English and in Spanish, and those go through the 3 rescue medications and then how to use that VNS magnet, a seizure observation record, and then our seizure action plan. Also on there, we have an on-demand training for teachers. So if you live in one of the states where seizure first aid and safety is now required, that is a place that you can help your school district direct to. Hopefully in the next year, we're going to come out with 2 more trainings. One is going to be for the general public. So that would be for you guys sitting here today. If you are part of a church, if you are part of a bowling league, y'all have trained all sorts of people. And so it's a really wonderful resource that you can send to anyone that you interact with regularly. And then we'll also be developing a police training in the next year. So that will be one that we will hopefully be able to share more broadly with police officers so that they're better able to respond to seizures as well. So again, I'm from Louisiana, and we do have member organizations in Caitlin or Dale. Do you know the answer to that question? Don't tell Lisa.
So where do we have members?
How many states?
All set right
Well, we have
now?
17 members, but okay, so we have members across the country. We also do have a helpline if you don't have a member organization in your state. You can call our helpline. With that, does anyone have any questions for me today? Yes, in the back.
Do you know any devices that can detect seizures?
So there are several devices that can try to detect when somebody. That's not us, right? Okay. So we do have a link to that on our website, but I know that there is the Embrace Watch, there is the MFit, which is a pad that you can put on the bed, and then there is the SAMI device. If you're interested in doing that, I do know SAMI is here, and then also the Danny Did Foundation. If you go to their booth in the exhibit hall, they should be able to answer your question much more in depth than I can. But yes, there are several different options. Any other questions? All right, well, thank you all. I appreciate it.